Everyone. My name is Dr. Barry Bittman, and it's a pleasure being with you today to present Optimizing Practice Performance. I'd like to take this opportunity to thank Dolores Green for her guidance and leadership in developing this program, and also for my co-presenter Mitzi Young, who is a physician advocate for RCMA and CMA, for developing and presenting this program today. With that in mind, I'd like to again thank all of you for your time this afternoon. And I hope that during the course of this presentation, we can answer your questions. Please use our chat feature to list your questions. If there's time at the end, we'll also take questions from the floor. At this point, your mics are muted so that we don't have interference with the actual audio for the presentation. We're going to begin by really talking about how we move from where we are now as a practice to where we need to be. Essentially, our focus is pretty straightforward. We recognize that the challenges of practicing medicine today in our current environment are difficult at best. Yet even prior to COVID-19, practice performance in most cases had not been optimized to the extent that was possible. And our focus is really on improving outcomes. As you know, medicine is essentially an art and a science, but it's also a business. And many practices that we're familiar with struggle unnecessarily based upon the fact that they've really honed the art and science of medicine, but it's the practice or the business work that seems to get them down. It's pretty simple to realize that medical school and residency training didn't teach you how to run a practice or a business. And our goal is really to fill that gap and help introduce the tools and insights that can truly make a difference and help you achieve practice success on many levels. Today, we're really going to focus on not only the workflow itself, but on also how to build in a very important element, and that is time. So I'd like to turn this over to my co-presenter, Mitzi.
Thank you so much, Dr. Bittman, and good afternoon, everybody. Thanks for joining us today. As you know, Dr. Bittman and I have put a series together. We've been doing these webinars about once a month and trying to really help people get through the pandemic and the national health emergency and trying to help those practices thrive. So today, we're just going to kind of build off of that. So what Dr. Bittman has already put forth, I want to just build on that. Obviously, in practices, I see every day as a physician advocate, when I go into practices, the business side of medicine is probably the one thing that's not talked about with the physicians and or the staff. So I think that over the years that I've been working and doing this kind of work and being in the trenches of the practices, we really want to make sure that we are optimizing every ability that we have in the practice. And that can be from obviously staff to practice management, billing, your EHRs, those kinds of things. And we're going to go over those things today. Again, most of the time, I agree with Dr. Bittman when he says that in medical school, you know, most of the time physicians don't get the education on the business side of medicine. So that's what we're really helping folks to understand and to see that and to look at the business as just not patients and physicians, but it's actually a business that needs to be ran with customer service and time management to run effectively. So what I really want to do is we want to take a look at, you know, a rational starting point. So we're going to use this presentation that builds on the webinar that Dr. Bittman did previously on team-based care. And so really what we look at is the value stream mapping. So that's what we're going to introduce to you today. And I think that it is actually a method that really will provide practices, staff, physicians with a go-forward plan to maximize their time in the office and to get better health outcomes, to get better patient satisfactions. Those kind of high efficiencies will do that in a practice if you're using value stream mapping. And this presentation will focus on that. And then also just remember to keep in mind that efficiencies not only impact patient outcomes and experiences of care, but it does contribute to the practice's discord and provider burnout, which is something that we're dealing with in healthcare in a very big way and have been even prior to the national health pandemic. Next slide. So it's about time. So what we're going to look at is we're going to look at some workflows. Okay, so in an orchestrated and repeatable pattern of activity, a precise sequence of operations, ensuring that the right things are done at the right time. So consistent flow of steps is going to be really what we're going to be focusing on. And so we're talking about the sequences and the patterns in this workflow. And so I want to kind of give you an idea of what I'm talking about. So when we look at patterns of activities, these would be, for instance, confirming appointments, sending patient information to be completed prior to the appointment. Those would be patterns of activity. And then the sequence in which you do them. So when you're confirming appointments, for instance, you're not going to confirm appointments a week ahead of time and send paperwork the day before. You're actually going to do a sequence of sending the paperwork a week before to the patient, either via the patient portal, which would be my favorite way, or email or regular mail. You would send that about a week ahead of time, and then you confirm appointments, 2 days or the day before. So those are the sequences that you would actually see in a workflow. Next slide. Okay, so when we look at value stream mapping, really what I want you to understand is that it is just simply the process of visualizing all the steps in a process from start to finish. So it's a flow chart based approach that enables you to refine a product or service in terms of determining whether each step yields direct value or generates waste. So a lot of people say, well, can VSM or value stream mapping actually work in healthcare? It absolutely can. One application for value stream mapping in healthcare is mapping a patient's path to treatment, then utilizing it to improve services and minimize delays as you go along, days and days, weeks and weeks, and things that change within the practice. So you really want to visualize the process, everything you have to do to eliminate the waste, which we're going to talk a little bit about later on in the presentation. So mapping a value stream allows teams to get at the truth, right? And that's what we really want to do. There's a lot of waste that's done in the course of a patient's appointment with your practice. So it helps us to observe our processes to discover what's really going on in our patient's journey. And that's what we really want to do. So we appreciate that quote from Ellen Noel from Virginia Mason Institute. So next slide. So transforming patient care. So really time management should be the top priority of all time, and that you are going to be looking at these to be used for continuous improvement. Time is everything, right? We know that time is really important to physicians, certainly when they're working in and out of hospitals, in and out of surgery centers, trying to get to clinic. Those kinds of things are always really important. Obviously with the staffing, that's also an issue. So timing is really something that we want to be a real huge focus in every practice. I'm trying to really teach folks that when I'm doing my practice assessments. So building on the principles that wasted time cannot be recovered. And that's really the truth. It cannot be recovered. A lot of folks think, well, I'll make up at the end of the day, or I'll let this go so that I can make up time. And that's not what we want to do. And that's not what we want to teach you today. So we want to make sure that you actually, know how long it takes you to get through a cycle or a patient's appointment. So remember that most valuable insights surface in the trenches. And that's for sure on the front lines. So we want to really listen to our staff. We really want to see what's working and what's not working. We want to work as a team or a group effort to make sure that we're getting through the patient's appointments and the time management is at its best efficiency or highest efficiency. So I always tell folks, please don't make changes in workflows on the fly. That's one of the worst things that you can do, and I see this a lot, is that we're just trying to scramble each day and we're just going to come up with processes as we go. Never a really good way to do things, feels really chaotic, doesn't feel like anybody is really getting a reward out of what they're doing every day and helping the patients, and the patients will notice this kind of behavior. So you really want to make sure that you know that your days, you'll have changes in them, and that's fine. And if there are problems, try to go over those with the staff at the end of each day and kind of see what didn't work in those workflow mappings that you've put together. And then the other thing that you want to make sure is that the team must consider whether the step brings value to the patient and whether a safer, more efficient, or more effective option exists. This is something that everybody should be looking at every single day. So all staff, all physicians, all providers. If the answer to any of these questions is yes, then there is an opportunity for improvement. And more than most likely, there always will be. So a lot of times people will say to me, well, it's the staff, that's why we're having problems, or it's the patients, they're not getting here on time, or it'll be so many different, the machines are not working right, or whatever it can be. And a lot of times that is just not what it's about. It's not about not having enough staff, but it's looking how to decrease the waste. So we really want to make sure that when we're kind of pointing fingers, if you will, on what's not working in the practice, that we really kind of look at it from that kind of higher level perspective. So I really believe that patient reviews should be looked at every week. Those are your websites that you, Health Grades, Yelp, Vitals, those types of things will always help you to kind of navigate and kind of see it through the patient's eyes, right? Remember that all of us are patients one time or another, and sometimes we forget that when we're working in the trenches all day long. And so we want to make sure that we're always bringing that back to our thought process as well. Patient surveys should be done all the time, not a few times a year. So that's just a continual process. I love patient surveys. I know Dr. Bittman feels the same way. It really will give you a gauge of what's happening, and you guys can make some decisions based on that and work out your mapping for that as well. Patient experience, again, is how you make them feel. So I want to make sure that people understand what patient experience versus patient satisfaction is. So patient experience is how you make them feel, and patient satisfaction is the interaction between the provider and the patient. So you can really see how, if you look at it this way, you can really curtail a lot of mapping from those kinds of descriptors. Next slide. So time element, this is something that we're just going to talk a lot about today because it's really probably one of the bigger problems in most medical practices. And what I mean by that is, again, it's not only staffing or physician providers, but it's patients, right? So patients are waiting a really long time. And what happens with that is that they either choose to go to another physician, which we don't want them doing, or they go on the websites and they really kind of, let it be known how they feel that their time is not valued. So you can see how time element considerations are huge overall in a practice, not just from the standpoint of the providers and the staff, but the patients and their families. So really the scope, all the work that needs to be done in order to achieve a project's objectives. So I think this is really important. Beginning from start to finish, can we identify all the steps in the process? And that's really what you want to do. That's where you want to start. Procedures for each position. I really like it. I think it's really good. It really helps folks when you've got people coming and going or any kind of turnover at all in staffing. Having procedures and policies in place for each position will really help you all to understand what needs to be done in those positions each day. I really like checklists Those can be very helpful, and it can be used in any situation in which numerous tasks must be completed in a relatively short time. So for instance, follow-up visits for a patient with diabetes and many electronic health records includes versions of such tools. So make sure that you're using those to the best of your ability. Flowcharts, which is also referred as value stream mapping or process maps, like the ones we'll show in this presentation, will help you to see the workflow processes and streamline accordingly. So I really think that this is really important. I think I see this a lot, and I'm sure most of you will be able to relate to this, but doing everything manually, not a real super good idea. We want to really make sure that one of the easiest ways to eliminate waste in a clinical setting is to use automation to your advantage. So some things that are fairly easy to automate with the right tools and medical practice management software kind of include appointment reminders that you can do via text or email or patient portals. So staff spends less time on the phone. Lab result reporting through a patient portal, like that a lot, or email if you have a secure email. Electronic patient intake forms that are automatically pulled from your EHR. So it's really knowing how to optimize these EHR and practice management softwares to make them work for you, working smarter, not harder. Integrated EHR and billing software that seamlessly transfers information about patient encounters and documentation. And then templates in your EHR to reduce data during charting and documentation. So you really want to make sure that you've got the training and that you're using these tools that you have in your practice that you're paying for, and you're using them at the most high level that you can use them, because they're really going to help you in time management. That I promise you. Next slide. So here's kind of what we're talking about. So if you look at a value stream mapping, this is a great, I think this is one of the best slides in this whole deck. And Dr. Bittman did this, so thank you for that, Dr. Bittman. And this kind of gives you exactly how long it takes you to do each step. As you can see, you know, you've got your scheduling and your preparation and your check-in, and right below it's giving about how long it's taking to do that. And that'll be determined by your practice, of course. And then as you go through the whole entire process, you can see that if you added this all up, it's about an hour. That's about how long it should take to get that patient worked up, scheduled through the clinic and out the door. So you think about this while you're moving along in your day, and as we teach you how to do this. So here's where it really kind of gets a little crunchy, and I'm going to send this back over to Dr. Bittman because he'll take it from here. And he's going to really talk about when things go wrong. So I'm going to pass it back to you, Dr. Bittman.
Thank you, Mitzi. That was a great introduction, and you certainly covered a lot of really salient points. My purpose at this stage is really to give you some key examples. The first one that I'd like to share with you is one of my favorite. This is a true story about a very large practice group in the Pacific Northwest that was basically losing workman's compensation patients. They were no longer being sent to the practice. And when they started reviewing the reasons for this, it became readily apparent that this had to do with expediency. So if a patient, for example, in an industrial environment hurt their back on the job, they would basically go in by the end of the day, report it to their employer. They'd probably see the office physician that afternoon or the following morning. They'd make a referral to the medical group, and this is a very large medical group, and it would typically take a week to 10 days to get them in. And when they got them in, they had a characteristic workflow. They were rather organized, and the workflow included, performing the routine examination, ordering a CT scan of the lumbosacral spine, for example, and setting forth a means to be able to communicate with the patient when the results were in. The CT scan on average took about another week. The office called the patient with the results and then subsequently scheduled physical therapy, which on average went on for 2 to 3 weeks. And then the patient was followed in the office again. It became blatantly obvious that from the back injury to seeing the the physician group the second time was typically 5 or 6 weeks, and that represented time off of work. So what this group decided to do is to use some of the strategies that we're going to introduce today and see if they could streamline the approach. They had protocols, they had workflows, but they really didn't have the time element down pat. So this is exactly what they did. They decided that if they were called by the industrial organization with a referral, that they would see that patient within 24 hours. So they immediately cut out a week to 10 days in waiting. When they saw the patient, they realized that 9 out of 10 times they could make the judgment about whether or not there was a herniated disc or a neurologic presentation and eliminate that through the physical examination. So they bypassed, in most cases, the CT scan and immediately sent the person to physical therapy. They own their own physical therapy service, and in doing so, they were able to spend 4 or 5 days with the patient, not only doing physical therapy, but also teaching them the exercises that they needed to do in order to maintain back health and to reduce their pain. Typically, they were able to get these patients back into their office in 2 weeks, at which time, not surprisingly, these patients tended to get better. They had, in many cases, been on analgesic or nonsteroidal anti-inflammatory agents. They were conducting themselves properly. They learned back hygiene, and 2 weeks after the incident, they were back to work. And you're probably saying to yourself, well, what happened as a result? What actually happened is the region transformed itself to this model in order to accommodate patients in an effective time management perspective, but also from a cost-efficient perspective. They were able to get people back to work in 2 weeks. And I thought that was absolutely terrific because it made a huge difference in how they provided care, and it also impacted their referrals. So what I'm going to do now is I'm going to share some examples, some practical examples that we see in day-to-day practice, and I'm really going to focus on primary care. You can adapt this to fit multiple specialties, but I think the modus operandi, our means behind the plan, are going to become very obvious. So I want you to track along with me. It's 11:49, it's not quite noon. Patient calls and says her ankles are swollen. She typically gets the answering machine queue, which is reviewed twice a day. She doesn't hear back at 1:15 because the office obviously went to lunch and they haven't gotten back yet. So she calls again and relays the same message. The actual response from the office to that call doesn't begin until the second shift of reviewing those calls, which is at 4:30 in the afternoon. And you have a nurse or an individual, a PA, who reviews all of those calls, goes through the typical EMR reviews for any elements that might be left out, and then at 5:15 attempts to call the patient back, and you can see that in blue on your screen. Bottom line is there's no response on the second attempt, which takes till 5:30 p.m. Now, the reason there's no response, and if you go to the bottom of the screen, you'll see it, is at 1:15, they called the second time, didn't get a response. But by 4 o'clock in the afternoon, not only was that person experiencing swollen ankles, they were also having difficulty breathing. The patient has a history and profile of congestive heart failure. At 5 o'clock in the afternoon, that patient is subsequently admitted to the hospital. So what could have been handled more efficiently now gets handled in a way that actually results in a potentially preventable readmission. So the question is there a workflow? And the answer is yes, but the workflow doesn't work. It's not effective. What is the scope of this analysis? It's really from the very first call to the admission to the hospital and actually the callback from the office, which is 5:30 in the afternoon. The cycle time is way too prolonged to make any sense. The wasted time is obvious. because the protocol doesn't work. There are multiple delays that don't have to occur. The outcome is not only does the patient's exacerbation worsen, but the patient winds up going to the ED and subsequently getting admitted. The impact, of course, is negative on the patient, and the financial impact I don't even have to discuss because it's extraordinarily apparent. Every time the patient gets admitted to the hospital, it's a DRG with payment whether the patient stays for 1 day or 3 or 4 or 10. So the bottom line is this is really an example of failure. But what I'd like to do is take this and try to turn it around and see if we can look at it another way. Now, what happens in this particular case is the patient is seen by this practice, and before the patient ever leaves the practice, they receive a brochure on how to deal with the symptoms of congestive heart failure. Every one of their patients with that condition get it. And it basically explains to the patient that you shouldn't wait until later in the day. If your ankles are swollen when you get up, the very first thing you should do, if this is out of the ordinary, is call the practice. So instead of waiting to just before noon to call, the patient actually calls at 8:45 because the patient is programmed to do so by an extraordinary set of explanations and brochures by the practice. The dedicated exacerbation hotline is reviewed hourly. So there are certain patients that are told to call a specific number. These are not numbers for refills, but this is a phone number that's set up specifically for exacerbation. That review only takes 3 minutes because they check it every hour. It's actually done between patients, so it doesn't take a lot of time from one of the PAs or nurse practitioners. And they review the EMR, just takes a few minutes as well, and they realize the patient has congestive heart failure. At 9:10, they basically call the patient back to schedule the appointment, and they ask the patient if they can come in within the hour, which is basically 10:15. They perform a follow-up visit at 10:15. They actually administer IV Lasix in the office. The patient is stabilized over the course of an hour and appears to be doing well. And then they set up a telehealth follow-up at the end of the day. And at 4:30 in the afternoon, the nurse practitioner or the physician touch base with the patient via Skype or FaceTime or just telephone, and essentially ensure that the patient is doing well, which he is. At that point, there's a discussion about increasing her diuretic medications, and the patient is well on her way to set up the another follow-up for this condition. But if we contrast this with the prior slide, you can see that there's no missed opportunity here. What we're really talking about in this presentation is the expediency of training your patient to contact the office immediately if there's an exacerbation, to deal with it on an hourly basis, to get the patient in as soon as possible, and to use technology, telehealth, to follow up with that patient later in the day. So what have we essentially done? 1, we've provided better care. 2, in the period during which the patient's condition was worsening, we actually treated that patient and we started to reverse that exacerbation. And by the end of the day, instead of looking forward to an admission to the hospital at 5 o'clock, the patient was actually relieved because she was able to touch base with the practice again and found out that she was doing better and was stable. So this is a contrast of workflows, but the differential point here is the time element, because what really makes all the difference when you start to look at your practice this way is that precious element of time that we can't recover. Let me show you another example. And I'm not going to go through these questions because we've just essentially answered them. Here is a call that's interesting. The patient calls the office and says, "Can I come in for a follow-up visit? Because I was in the hospital last week." The call only takes a few moments. The office responds immediately. Someone picks up and says, "Our soonest opening is in 2 weeks," and the patient is subsequently scheduled That only took 2 minutes of office time or less. Now you're probably saying it doesn't get more efficient than that. Well, remember we talked about scope? Scope was start to finish for everything that was included in the episode. What actually happened here was on October 17th, which was 3 days later, the patient began to experience dizziness and immediately presented to the emergency department. The patient was there for an hour and was subsequently readmitted for worsening congestive heart failure. So that patient was in the hospital for 4 days. So what the practice dealt with in only 2 minutes seemed to be expedient, but it really didn't cover the issue temporally. It really didn't cover the issue from the perspective that if they had gotten that patient in sooner, perhaps they could have prevented that exacerbation and hospitalization. Was there a workflow? Absolutely. Was it effective? No. What's the scope? It's really start to finish. It's October 14th through 4 days after October 17th when they're admitted. The cycle time is long. Lots of wasted time in the middle, delays that shouldn't have happened, a poor outcome. And the patient impact? Another hospitalization. And by the way, I'm not saying this in a condescending fashion, but you all realize that being in the hospital can be challenging. It can be actually a very dangerous place, especially with individuals with chronic illnesses who have the propensity to pick up other things while they're hospitalized. The financial impact is obvious. The readmission never should have occurred, which brings up the fact that I believe 88% of the hospitals were reported by Kaiser last week to have been penalized in the context of readmission penalties. So could that have been avoided if we would have had a better front desk policy? So what I'm going to do is show you another way to deal with this particular issue. And this is one of my favorite. When you look at this particular example, what you're seeing over here is no initiation by the patient. I want to emphasize that. The patient does not initiate the episode of care. What actually happens is you begin by using the alerts that come from Manifest Medics. They're available every day. If you're not connected to it, you ought to be, because this alone is a reason to be connected to the HIE. So every day in the morning, especially with our programs, we actually not only look at the alerts, but we actually send an email to our practices. They take a look at the list. It's generally not very sizable unless you're a large practice. They go through what they have in the EMR and of course the HIE, which is extraordinarily valuable, provides information that you never would have had in your practice. And without the patient calling, they schedule a follow-up. Now, as you know, we really shoot for 7-day follow-ups. However, this patient, according to what's in the EHR and the HIE, actually has been readmitted typically 3 or 4 days after they've been in the hospital. So they decide that according to their protocol, their workflow, they're going to get the patient in on the 13th. And when they get the patient in on the 13th, they notice 8-pound weight gain in just a few days based upon retention of fluid. And they realize that they have to increase the diuretic dose. And they actually provide that in the office. That only takes a few minutes. This is not a prolonged visit. And what happens is on the 15th, they do a telehealth visit with the patient, and the patient is doing well. Bottom line is, the scope of this work didn't actually begin in any way, shape, or form with the patient calling in. The protocol or the workflow is established by utilizing and leveraging the HIE and the EHR to be able to fully understand what that patient was facing and to basically head the problem off at the pass, realizing that 7 days was probably too long to wait for Mrs. Smith. She's a frail elderly woman, so they got her in soon. And in doing so, they were able to avoid a rather significant exacerbation and hospitalization. This is so important because what you're looking at over here is an effective workflow. And efficacy is not just based upon the steps, or as Mitzi mentioned appropriately, the sequencing. It's really timing. Timing is everything. And in healthcare, we often don't think about the time that we waste, and we very rarely think about the time that's wasted when somebody sits in the office. And you have no idea how many patients sit back and say to themselves, this may be a great doctor, but the last time I walked in, I was basically in that office for an hour and a half. And that was a waste of my time. And that's really the key element here. Now, I know you're saying to yourself, there are emergencies and there are challenges, and you certainly can't do well with every situation. But if you set up a workflow in your office where if the doctor has to be in the hospital or has to be somewhere else or is late for a reason, and it's beyond a certain amount of time, then you actually call the patient and you say, can we reschedule your appointment to a half an hour or an hour later today? If you start taking that into consideration and start valuing not only your time, but the patient's time, it makes an enormous difference. It's really the element, again, of the steps, meaning the protocol, the sequencing, getting them done in the right order, and applying the right time frame. So finally, what's at stake? I think it's pretty straightforward. We're not only talking about office efficiency, we're talking about patient outcomes, as I've demonstrated for you in my examples. The patient and family experience of care is also critical here, and you are being judged. Healthcare expenditures can certainly be reduced if we set up the proper workflows with the time elements that are really most efficacious. Quality performance is ultimately what concerns me the most, because we really judge our performance today based upon patient outcomes. CAHPS and clinical surveys obviously suffer, and let me tell you, when patients are upset, they are blatantly honest. They basically say everything negative. So you can be doing a lot of great things, but you keep them waiting for 2.5 hours, or you don't get back to them till the end of the day when they're calling in because of an exacerbation of symptoms, or they call in the evening and your on-call physician doesn't really want to take the call, so there's no guidance, or the answer is simply go to the emergency room. These are the things that patients remember. So effective strategies are really important. I also believe that your outcomes clearly affect capitation rates. In shared savings and risk-based contracts, they clearly impact the amount of money that can be received by the group. This could impact practice growth in two ways. One, word of mouth, and two, the health plans can decide, well, there are too many complaints about these practices, so we're not going to expand their overall patient cohorts. Ultimately, we're also talking about practice-based financial viability. If you're doing things in a manner that's not efficient, I guarantee you it's going to cost you more. And I can say this right now with a great deal of certainty. A lot of smaller practices say we can't afford to do this. And I'd like to make the case that if you do time studies and you really start to analyze these gaps, you realize that you can't afford not to take these steps. Finally, we're not just talking about patients, we're talking about your employee performance, well-being, and work satisfaction, which really comes into play. Is all the work jammed into one part of the day? Are you checking your phone calls at 4:30 in the afternoon when everybody needs to get out at 5? Do you have a meaningful workflow that respects the needs of your staff? That's all really critical in this whole thing. And lastly, and certainly not least, is provider burnout. And I really believe that the frustration is so much greater in running a disorganized practice than it is in running one that operates like a fine-tuned watch. So my final recommendations to all of you are you sit down and you figure out a way to map this stuff out. You don't pick 10 areas to focus on at once. Perhaps you pick one. Listen to your patients. Find out what they're telling you. Work on one strategy at a time. And I can tell you without any reservations that Mitzi is the person who can help you do it. So I'm going to turn this back to Mitzi.
Wow. Thank you, Dr. Bittman. That was fantastic. I learned a lot in this one. And so here's what I want folks to know. How do you implement? We want to take some considerations into account here. So obviously we've learned today that effective workflows are really the foundational building blocks. And we want to make sure that we are looking at workflows and taking a step further into value stream mapping, as Dr. Bittman has showed us how to do that today. He's given us some really great examples and some building blocks which to build on and to learn on. The best way to begin is to focus on one operation at a time. So I would say to begin this, I think that every staff member should do their own mapping of their position and what they're doing and time that out. And certainly we can help you do that. As you can see, we've got some great templates. I'm going to give you some information on the next slide on how we can better help you and be a resource and have tools to help you. Remember that this is a team sport, guys, and not a top-down process. So the responsibility as a provider is to convene and coach the team, listen intently, challenge all assumptions, and measure results. That's really how you're going to get where you need to be. It's one step at a time. Change is never easy. It's not, people just don't like to change at all. None of us do. But we can't keep doing the same thing and expect different results, because that won't work. And we know that blaming other folks in the practice, that doesn't work either. And blaming patients and their families, that doesn't work. So we really need to do something different. And that's what we're trying to teach today. What I really want to tell you, though, is that it never needs to be cemented in stone right away. You need to do trial periods. You need to look at these things and say, let's try them, right? We don't have to just carve it out. Let's just try it for a 30-day trial, perhaps get everybody on board, and really make a conscious effort to do that. And then go back to the drawing table after 30 days and go, hey, what worked and what didn't work? And what do we need to tweak? And what do we need to do? And that's really the best way to do change in any area of our life, is never look at it as a permanent until you've decided that we're going to solidify it. So the next slide, please. So this is really important. So now that we've given you all of this, how can we help? Well, we can help in so many ways.
Before we go there, Mitzi.
I'm sorry?
Before we go there, I have just
sure.
one more comment that I think will be especially helpful. Rome wasn't conquered in a day, and you're not going to transform your practice in a day either. But I think this is the best topic you can imagine for what I call an office pizza lunch. And I think you should schedule one every single month where you get your staff together. You allow your staff to come up with ideas for these processes, things that aren't working or things that could potentially be improved. It could be something as simple as how you handle the calls at the front desk, or how you schedule, or how you follow up, or how you use the HIE. But choose one element a month, and during that in-office lunch, sit down with your entire team and see if you can collectively bring forth the insights that can help you build a process map by the end of the meeting. So the goal is, by the end of that hour or 45 minutes, you actually have a map that you're committed to using to guide that process or that workflow moving forward. That's really easy to do. And I promise you, if you do one a month, in 12 months, you won't recognize the change, the phenomenal change that is occurring in your practice, because it'll become part of your culture. It'll be something that you look back at and you'll say, my God, I think we've always done this. And you realize that it's only a year. So with that, I'll give you the next slide.
Thank you, Dr. Bittman. That's great advice. So really the resources go on and on and on. So I really need folks to understand that as members of the Medical Society, you have access to a plethora of free tools and resources, one of them being me, as your physician advocate for the Riverside County Medical Association. I'm really your private medical practice management consultant for the price of membership. So use me as you will. I really want to hear from you. I want to help you. We all do. We have come up with tools and resources and toolkits to really make your life so much easier every day. And I really would encourage you all to make sure that you're using them. You will get a copy of this presentation that will give you the emails and phone numbers and the resources and additional support that you guys have access to. So don't do it alone. You'll hear me say this over and over again. If it takes you an hour to project manage something and you still haven't gotten the result you want, you need to pick up the phone and call us, because we can make it rain in resources for you, and we can make things so much easier every single day, including learning how to do this mapping in your practice, which will work for small solo docs, as well as it would for any larger medium-sized practices. So with that, I'm going to thank you all so much for listening to us today. If you have any questions, please just pop them in the chat box and we'd be more than glad to answer those for you. And I'll send it over to you, Dolores.
Okay, thank you, Mitzi. I appreciate that. And Dr. Bittman, while people are putting in any questions that they may have, I have a couple of questions or requests for information. So the first is, can we provide a copy? Great, thank you. I hope everybody found that helpful, because it is very important that you do the transition of care visit for your patients for a number of reasons, but there is certainly a financial benefit for doing that. So if you need additional information on the criteria for that, we also have that available. And on the slide that you're seeing, there is information on Manifest MedX, the Health Information Exchange, and that is local here in the RCMA office, and you're welcome to either utilize that website or call the RCMA office and we'll connect you so your practice can become a participant. There's no cost, so I encourage you to do that if you're not already a participant. I don't see any more questions, so at this point I would like to thank Dr. Bittman and Mitzi for their time and the knowledge that they've willingly share with all of us. And I hope everybody has a great day and look forward to our next webinar. You'll be getting that information in your inbox soon. So thank you.